many people take prescription drugs and dietary supplements every day and reap the benefits of them. But are there any risks in using them together? Here to share their insight, please welcome physician Dr. Elaine Chin and naturopathic Dr. Elizabeth Goldspink. Hello, both of you. It's been a while. Yeah. Welcome back.
Thank you.
So let's talk about it. Pharmaceutical drugs and dietary supplements, are they regulated the same way?
Almost. I mean, both are regulated by Health Canada and in the U.S., the Food and Drug Administration.
Okay.
Definitely much more vigorous with drugs, less so with supplements because in theory it's more natural. But I think we're going to show you that they can be equally dangerous.
Right. I mean, when you look at the media coverage of dietary supplements, it feels almost like the Wild Wild West. Like, are there any regulations? Is there anything showing us what's okay and what isn't?
So that's a great question. And prior to about 10 years ago, the Food and Drug Administration and Health Canada, they didn't have good manufacturing practices in place. But since the last 10 years, they do. And so no, it's not the Wild Wild West. There's a lot of safety that goes into through both organizations to ensure that the raw materials are tested, finished products are tested, accurate labeling. So it's quite safe.
Is there some kind of a certification we should be looking for on dietary supplements? Yeah,
CGMP compliance, certified good manufacturing practices on dietary supplements.
So look for that then.
Yes.
And then you can sort of be safe that you've got a good
And in Canada,
product.
they should have an NPN, natural product number, on it.
Okay.
Yes.
Good to know. I want to talk about the green tea liver toxicity scare. So is green tea not considered safe, or what can we learn from that incident?
So I think what we can learn from that is, yes, green tea is completely safe and highly beneficial, so don't stop drinking green tea.
Yeah.
The issue is when we take a component part out of the whole and then concentrate it.
Yes.
So catechins, which are the antioxidant component in green tea, when you take those out of the green tea, you put them in a high dose, push them into a pill, and then take them for, say, weight loss, that's when it becomes risky and it can impact your liver negatively.
Right.
But it would take about 8 cups or more of green tea to hit the level of catechins that could be potentially risky. And I don't know anyone who drinks that much green tea.
Yes.
So it's not a risk if you're just drinking the green tea.
Okay, so staying on top of all of that, I mean, as a doctor, what do you ask your clients to do? Do they come in and do you ask them for a list of all the supplements and all the pharma, like everything they're taking, so you know?
Yes, well, in theory, the answer should be yes.
Yeah.
And it's really nice when people take out their wallets and they pull out a little piece of paper that's like ripped up in half.
Yeah.
But really what you should be doing is taking an app that's available and put all your drugs and your supplements, and make sure you try to go to an MD with an ND that's affiliated, and try to stick with the same pharmacist so that person knows what you're taking on both sides of the fence.
That is such an important thing to do. Your pharmacist can almost be part of your family.
They are part of your family.
They're watching what's happening and what's going into your system, but the thing about it is they don't necessarily know what your supplements are. So you really have to be your own advocate, even if it is the torn up little piece of napkin. Write it down.
Than nothing.
It's better than nothing. Let's talk a little bit about using both together then. What do you need to, you say there's a test that you can actually do so that you know if you're going to have an adverse reaction.
Yeah, so this is called Pharmacogenetics, otherwise known as genetics, testing for your sensitivity and ability to break down certain drugs.
Okay.
And it also applies to supplements. And the thing that I think is really important is it also applies to cannabis. Cannabis is a drug. And you can do pharmacogenetics around that.
Yeah.
So it's the same thing. And this way you know if you have a poor metabolism in your natural constitution. So moms who take painkillers as an example, if they are a slow metabolizer, there is more drug in their body, and it's not just the blood but in their breast milk. And so when you give it to the baby, we think that that's part of the problem when babies have all of a sudden can't breathe, because it's in their breast milk, it's in the baby, and then it's too overdose of a narcotic.
Okay. I wonder if we should talk more about cannabis. Are people being safe with their cannabis use? Like, are there regulations out there? Should you be doing a test to see how your body is dealing with cannabis?
Yeah, we talked to Elizabeth and I. So in our perfect world of being personalized medicine practitioners, the answer is yes. And there are tests out there now to be able to test if you are sensitive to CBD or you're sensitive to THC. And for example, for me, I discovered that I have a higher sensitivity for developing psychosis, anxiety with THC, so I'm going to have a bad trip. So I'm going to
Maybe
take a
you're
pass.
gonna stay away.
I'm going to take a pass.
Yeah.
Take a pass.
How do you get those tests done? What do? You go to your doctor and say, I want to be tested for
Yeah,
this.
you know what? You can probably find it online, and certainly if it's hard to find, Elizabeth and I do take care of that.
There you go. Go find those two and get tested so you know what you can take. Thank you so much for that information.